I need to tell you something that's been eating at me for years, and I know the moment I say it out loud, some of my colleagues are going to be pretty upset with me. But after more than 2 decades in medicine, after watching what happens to people when they follow every single recommendation that comes their way, I can't keep quiet anymore. I'm Dr. Michael Kent, and here's the thing nobody wants to admit. Sometimes the worst thing you can do for your health is get too many tests, especially after you hit 60 or 65 years old. Now, I can already hear some of you thinking, wait a minute, isn't this doctor supposed to be telling me to get checked for everything? Isn't prevention supposed to be the whole point? And yes, that's exactly what we've all been told. Catch it early, find it before it's a problem, stay on top of everything. That's the message we hear everywhere. But what if I told you that message is leaving out the most important part of the story, the part about what happens after you find something? Because here's what they don't mention in those commercials for health screenings. Once you find something, anything at all, even something that would never hurt you, the wheels start turning. And sometimes those wheels run right over your quality of life. So today, I'm going to walk you through 4 medical tests that I see causing more problems than they solve, particularly for people over 60. And I'm not doing this to scare you away from doctors. I'm doing this because I want you to understand what you're signing up for before you say yes to every test that gets offered. Now, before we get into the specific tests, I need you to understand something that changed the way I practice medicine. It's something called the cascade effect. And once you see it, you can't unsee it. Here's how it works. You go in for a screening test. Let's say you feel perfectly fine. You're living your life, doing your thing. The test comes back and shows something. Maybe it's a spot, maybe it's a shadow, maybe it's a number that's a little bit off. Now, that something might be completely harmless. It might have been sitting there for 20 years and would sit there for 20 more without ever bothering you. But here's the problem. The doctor sees it, and now they have to do something about it. Because what if they don't, and what if it turns out to be serious? So they send you to a specialist. The specialist orders another test, a more detailed one. That test maybe shows the same thing, still not clear. So now we're talking about a biopsy or a procedure, or maybe even surgery. And each one of those steps has risks: infection, bleeding, complications, anxiety, lost time. And here's the kicker. When you get to the end of all that, 9 times out of 10, you find out it was nothing. It was never going to hurt you. But now you've been through months of worry. You've had procedures, maybe you've had complications, and you're worse off than when you started, all because of a test you got when you felt fine. That's the cascade, and it starts with a single test that maybe you never needed in the first place. So let's talk about the first test that I see causing this problem over and over again. And this one's tricky because it sounds so smart, so modern, so preventive. I'm talking about whole body scans, full body MRIs or CT scans that promise to check everything at once. You've probably seen the ads. Come in, we'll scan you from head to toe, catch anything before it becomes a problem. It sounds amazing, doesn't it? Like getting a complete picture of what's going on inside you. And I get it, I really do. The idea of knowing everything, of having control, that's incredibly appealing. But here's what happens in reality. Let's say you're 65 years old, you feel great, you're active, you've got no symptoms of anything. You decide to get one of these scans just to be safe. You go in, you lie down in the machine for 30 minutes, and a couple days later you get your results. And right there in the report, the radiologist mentioned something, a small nodule in your lung, 3 millimeters, about the size of a pencil eraser, or maybe a cyst in your kidney, or a spot on your liver. The report says, recommend follow-up imaging in 3 to 6 months. Now, how do you feel in that moment? You went in feeling healthy, and you came out being told there's something in your body that needs watching. You probably can't think about anything else. Every time you take a deep breath, you wonder about that lung nodule. Every time you feel anything in your